Well, good evening, everyone, and welcome to Virtually Speaking, a Columbia Nursing webinar series. I'm Riva Feinstein, Associate Dean for Development and Alumni Relations, and today's program is Columbia Nursing and NewYork-Presbyterian, joining forces during COVID-19. It seems especially prescient. We're holding this today on the first day that vaccines are starting to be administered. Got chills this morning when I saw the nurse getting the first inoculation on TV. We periodically present webinars such as this one on a variety of topics, and we look forward to seeing you at future events in the new year. So just very quickly, I have a few housekeeping items. Thanks to all of you who submitted questions ahead of time. We'll be addressing these later in the event. And please note that everyone except our speakers will be muted. Kindly utilize the chat feature located at the bottom of your screen if you have any new questions that come up for our speakers tonight. We'll be monitoring those, and time permitting, we'll address them at the end. And lastly, thank you in advance for your patience if we have any technical difficulties. It's now my pleasure to introduce today's moderator, Rose Chapman Rodriguez, class of 1987 and 2006. She is the Nurse Practitioner Program Director at NewYork-Presbyterian Morgan Stanley Children's Hospital. And Rose also serves as a board member of Columbia Nursing's Alumni Association, among many other accomplishments. So Rose, I turn it over to you.
Thank you, Riva. I'm excited to join everyone this evening to celebrate and discuss the unique partnership that was forged between Columbia Nursing and NewYork-Presbyterian during the COVID-19 pandemic. Tonight, we will hear from two faculty stakeholders, Heidi Hahn-Schroeder and Courtney Vose, who will explain the execution and importance of the partnership, followed by Danielle Wright, Alden Bush, and Katherine, who will reflect on their experiences as students during this pandemic. The World Health Organization, WHO, designated 2020 as the year of the nurse. Nurses all over the globe showed up. They showed up as clinicians, educators, and visionaries for our communities, for social justice, and for one another. More than ever, every nurse was a leader, dealing with crisis management, leading with compassion, and acknowledging the value of connections and partnerships. In recognition of their commitment, the Year of the Nurse is being extended into 2021. Personally, I witnessed this partnership. From April through July of this year, nurse practitioner students volunteered to create an obstetric postpartum outreach team. Guided by a clinical script, they made follow-up calls 48 to 72 hours following discharges from our obstetric service. Mothers were discharged earlier than usual, so these 10-minute follow-up calls helped address their mental, emotional, and physical well-being, along with an inquiry about the baby's health status at home. 1,388 patients were called. We had a 72% contact rate, and it led to 29% of all those calls that required an escalation, either clinically to the attending physicians for symptoms, for social work connections, medications, or even clarification for when their next telehealth visit would be or when their in-person visit would be, which was also extended a little bit further. So a whole change in our care plan because of this connection that students made. This initiative demonstrated quality and safety and improved communication and the patient experience. Currently, I'm really proud to say that our nurse practitioners continue to do these discharge calls as advanced OB providers. It is now my pleasure to introduce Heidi Hahn-Schroeder, Assistant Dean of Academic Affairs and Director of the MDE program at Columbia Nursing.
Thank you, Rose. I would also like to introduce and thank Susan Chin from NewYork-Presbyterian and Director of School Affiliations, and Candace Smith, Assistant Director of the MDE program and Director of Clinical Placement, who were integral members of this process as well. I'm just going to share my screen quickly. So The Master's Direct Entry program is an accelerated program that offers basic competence in professional nursing and generalized master's coursework. Students have a degree in something else, whether it's a bachelor's up to a doctorate, and come from varied backgrounds. Students complete 72 credits in 15 months. At the end of our program, the culmination of the clinical experiences ends in the integration of nursing practice. However, when students were preparing for their integration experience, COVID-19 struck New York City. The response had to be swift and efficient. The first thing we did as a school was move all of our classes online. At that time, our clinicals were suspended by affiliates and through the decision-making of our school. However, our students verbalized readiness to work during the pandemic. And that is where the academic clinical partnership with New York-Presbyterian grew from. The roles were quickly identified by our nursing leadership, the Dean Fraser from the School of Nursing, Willie Manzano, and Mary Lou Parado. And then it got filtered down after the big decisions were made and how this would grow, how it would be envisioned. It was decided that this would be voluntary for all of our students to participate. Students had different reasons why they wanted to be able to engage in this particular partnership and other reasons why they were unable to. So voluntary was very, very, very crucial. Additionally, this partnership where there was an academic side and a service side was mandatory. The students needed to not only be supported by the staff at NYP, but supported by the faculty at our school. And then the training. The training ended up being a shared responsibility between our school and the New York-Presbyterian nurse educators. Our simulation team quickly and swiftly worked with the education partners at NYP to establish an orientation process. This was both done through learning modules online, and then there was an in-person component where the nurse educators from NYP and our simulation team met with students to validate skills before the students went into the clinical area. A key component of this was faculty support. All students were required to meet with their faculty on a weekly basis. We offered educational opportunities such as cutting-edge articles and interventions that were discussed, in addition to an area to provide mental health support and debriefing of what the students saw in the clinical area. This is just a picture of some of our students that partnered in this unique opportunity that many other schools of nursing did not have the opportunity to do. Some of the feedback from the students included from a recently published article from Susan Chin and Christine DeMayo in the NYP Nursing Connection. Ashlyn Lord stated, "I worked the evening shift, which meant that I had the pleasure of working with both shifts and night shift nurses, all of who were patient, encouraging, and eager to teach. Even when they were busy managing a full floor of critical patients, they epitomized time management, taught me prioritization, and always made sure I was involved in any complex or interesting cases." Another student that Susan and Christine highlighted in their article was Julia Reamer. She said, "I am incredibly grateful for enormous personal and educational gains that I accrued as a result of my role. The nurses on the unit welcomed me so warmly and graciously allowed me to shadow them and assist them with procedures to provide me with exposure to the NICU RN role. Their eagerness to share their knowledge and expertise demonstrated their leadership, passion for passing on the skills they have acquired throughout their careers. They modeled resilience, dedication, and above all, kindness during an extremely dark time in our city." We are very proud of this shared academic clinical partnership that we were able to undergo with New York Presbyterian. It is now my pleasure to introduce Courtney Vos. Courtney Vos is Vice President and Chief Nursing Officer at New York Presbyterian.
Thank you, Heidi. Let me transition to sharing my screen. Oh boy, I think I just lost my presentation. I apologize. I'll be right back. Okay. Here we go. I'm thrilled to be here with you tonight. There is so much going on. I can't believe it, actually. We're in a COVID resurge. Vaccines are coming. They're actually in New York. We've had some folks receive the vaccine already. And then just layer on top of that a snowstorm. But I would absolutely never pass up on the opportunity to speak with my Columbia University School of Nursing colleagues and these amazing students. Before I start, because some of you may not know about New York Presbyterian Hospital, we are one of the most comprehensive integrated academic care delivery systems in the world. We serve Greater New York, the nation, and the world. We collaborate with two renowned medical schools, Weill Cornell Medicine and the Columbia University College of Physicians and Surgeons. We're proudly ranked number 4 on US News and World Report and number 1 in New York, and we are newly magnet designated. In preparation for tonight, I had to reflect on the early days. They were really a frightening time for us. It reminded many of us of the HIV and AIDS epidemic in the early 1980s. For this disease, though, the timeline was really short for the brunt of the volume of patients. We went from the first patient being diagnosed on February 27th to Governor Cuomo declaring a state of emergency on March 7th. The first patient in New York sadly died on March 14th, and things really escalated after that. In just over 9 weeks period of time, 21,000 New Yorkers would die from COVID. Nurses would tell me that they had seen more death in a single shift than they had seen in the entire previous year. The mortality rate and the volume of high acuity patients is nothing like we could have ever imagined. And the images live on in all of us. The number of ventilated patients and devices that they were on. The morgue trucks parked outside of our hospitals because we couldn't accommodate them in our hospital morgues. And the faces of our staff and the students as we would round and try to meet their needs. The emotions are really hard to capture, but this may help you to remember that feeling and to understand the frontline emotion and needs during the early days.
I was really scared. I was anxious. I couldn't sleep at night.
It's been one of those days. One of those days that I need to talk.
No, I prayed a lot and it helped.
This has been crisis intervention completely. The pressure, the sheer numbers of patients is intense. feller's gonna die.
I went through this, it changed your perspective in life, like what is more important.
Unless you've worked in this field, you truly have no idea.
And so that video actually makes me really emotional still to this day, because I'm so grateful for everyone, especially tonight, our students. I really want to thank Dr. Lorene Frazier for having the insight to reach out to us to suggest an idea that I think is an innovation that that academic organizations across the country should use, iterate, or just replicate. She was concerned for her students' education due to the potential for losing the one-to-one preceptor experience. And you guys have met Dr. Susan Chin. She reached out to Dr. Susan Chin and Dr. Mary Lou Prado Inzerillo, who is our director of corporate nursing. And together, they figured out a way to have us collaborate in a way that would be mutually beneficial to both organizations. We were able to help the students to achieve their academic needs. And for us, we really, really needed their help. We couldn't have done it without them. And I'll probably never be able to convey the gratitude that I have for their arrival. I think when we first started talking with the school, we were determined to keep the students segregated from the COVID positive patients. And as we talked about the volume, that just was not possible because our hospital was filled with COVID positive patients. And so Dr. Frazier asked me to meet with the students and to have dialogue with them to explain how we would try everything possible to keep them as safe as possible, and to ask them to continue to commit to come and spend time with us during this critical period, despite the fact that they would be taking care of grossly, the majority were grossly positive COVID patients.
Courtney, can I just ask, can you put your presentation in slide view? We're unable to see it.
Oh, I have it in slide view here. Is that better?
Yes, perfect. Thank you, Courtney.
Okay, very good. So when the students started to arrive, we really needed them the most. Again, they were volunteers. They're true heroes. If there are any heroes in this, it is those that volunteered to come and help us when they didn't have to. They will always be family to us. It literally brings me to tears to this day when I think about the relief that they provided. They worked as techs, and so they were able to do things like help with bathing, help with feeding, do blood glucose checks, EKGs, etc. And that extra support as we stretched our regular staff further than they had ever been stretched in ratios was imperative to being able to safely take care of patients. And then finally, the relationship. I think our relationship with the school is only improving. I've been doing this for a long time. I've been in nursing leadership for 30 years. And the marriage of academia and clinical nursing is something that many of us have only dreamed of. And I feel blessed to partner with the school so that we can continue to learn, grow, develop, and help each other to achieve our goals. These are just some of the quotes from our staff related to our students. I'll read you one of them and then talk to you about one that I actually got today while I was rounding. Vanessa says, I actually saw some of the students that I taught in clinical. I was very proud to see them working on the floor and amazed at their courage to take on such a task. And then today, Liz, one of our nurses on 9 Hudson South, said, they jumped in fast and furious. We wanted them to stay forever. So here we go into our next forever. We're in round 2, and we're thrilled that so many of the students want to come back and spend time with us. We have a more efficient way for them to sign up and come to work with us, and they'll be working with us in 2 capacities. Those that are now registered nurses will be helping us with COVID screening. We're grateful for your support. And those that are still in school will be coming back to serve as techs again. And then finally, it is really a moral obligation for us to continue to share this information so that others can benefit. And so I'm happy to be joining you tonight. We do have a publication regarding this, which was recently accepted into the Journal of Professional Nursing. And then, of course, we will be archiving this for those who follow us. Thank you so much.
Thank you, Courtney. Is there any possibility that you could replay that video? For some reason, we didn't see it, and I agree. I think we will all be so touched.
Sure, I'm happy to try again. Can you see my slides?
Yes.
Are they in slide view?
Yes.
Okay. Oh. Okay, can you still see my slides?
Yes.
Okay, let me try this.
There you go.
I was really scared. I was anxious. I couldn't sleep at night.
It's been one of those days. One of those days that I need to talk.
No, I pray a lot and it helped.
This has been crisis intervention completely.
The pressure, the sheer numbers of patients is intense.
I felt I was gonna die.
Went through this, it changed your perspective in life, like what is more important.
Unless you've worked in this field, you truly have no idea.
So it's a very powerful video, and their words are so much more powerful than mine. And so again, my sincerest gratitude to all of the students who came and really saved us.
We'd like to now introduce the 3 students, Danielle Wright, Alden Bush, and Katherine Silva, if you could please.
Hello. Hi, everybody. My name is Danielle. And I guess I'm going to go first. So yeah, my name is Danielle Wright, and I'm currently a newly registered nurse, and I'm in my first year of my DNP program pursuing the midwifery track. And so to just share some of my experience during this collaboration and jump right into it, I worked at the NYP Lower Manhattan location. Lower Manhattan campus, and I worked nights for the first time, which was a learning experience on its own. And when I walked onto that floor, my experience was great. And what I mean by great was, like some of my peers mentioned with the quotes that were shared, the nurses were very welcoming and warm and very happy to see us. They were very grateful and consistently reminded us that they were happy to have us there to help them out. And so when I was reflecting on what I wanted to talk to you all today about, my experience, like Courtney said in the earlier days, something that came up for me, to be honest with everyone and be pretty vulnerable, was I felt like I couldn't believe I was chosen to speak today. And what I mean by that is I had some feelings that I've been struggling with being an imposter and comparing my experience to those of my peers. The amount of patient loss that Courtney spoke to and the trauma that my peers, that we shared with each other during that time was something that I personally did not experience at the sheer volume that some of them that they did while my experience at LMH. And so I felt these feelings of not feeling like I was truly on the front lines, or I wasn't really doing enough, or I wasn't contributing to helping out these nurses. And but then I was thinking about a specific patient experience that I had when working there that kind of had me reflect a little bit deeper on that thought. And I was instructed by my nurse to take care of a new admission that night. And when I went into the patient's room, doing the normal vitals, and I noticed he was wearing an NYP badge. I did not address that he was wearing the badge. I let this patient kind of just, you know, have a one-on-one dialogue with me. I didn't really tell him who I was, just treated him as if I was his nurse. And then he began to open up to me. I found out he was, you know, an employee of the hospital and was actually a physician's assistant. He shared with me his vulnerabilities, his sadness of what was going on at the peak of this pandemic. He really opened up to me. As many nurses know, our patients will open up to us fairly quickly. And I just was there as a listening ear to him. And I bring up this story because he shared with me his own version of imposter syndrome that he was struggling with during the pandemic, from transitioning from his usual practice to going to the ICU and the ED at that time. He shared with me his fears. He shared with me his feelings of inadequacy, feeling like he didn't do enough, and feeling some embarrassment of being in the hospital and you know, opening up about his struggle with his mental health. And I think that video that Courtney showed was perfect transitioned into what I had to say, because the mental health of not only our patients, but the physicians and the healthcare workers is something that has been truly, truly affected. Is not as great, you know, if not as great as the death that we've seen since March. And it was truly a humbling experience for me, because he was able to open up to me, not knowing who I was. And I was able to just be there for him. And the more I reflected on this experience, I was thinking, you know, we were so starkly different, right? In age, in gender, in the points in our career, me being like a nursing student almost done with school, and him being an experienced provider. And yet here we are sharing the same similarities as a human, you know, as human beings, sharing the same vulnerabilities of being insecure and not feeling like we're doing enough, especially at such a vulnerable time in our nation for everyone, regardless of if we were in the healthcare field or not. And I thought that was something that was very valuable for me to come back with and to share with you all today, because I really wanted to just highlight that, you know, although the physicality of this pandemic is very important, nurses were physically saving people's lives, the mental health of our patients and our providers is also at stake here. And we really need to make sure we, you know, stick together, talk to each other, listen to each other, check in on our doctors, check in on our colleagues, check in on our friends, and make sure we know we're doing okay. And, you know, just realize we're all humans trying to, you know, this is a very human experience, and we're all trying to get through this together and, you know, make it out of this alive. And that's all I have to say. Thank you for listening. And I would like to now introduce my peer, Alden.
Hi, everyone. Thank you so much, Danielle, for your candor and everything that you said. My name is Alden Bush. I am currently a recent graduate of the MDE program and currently a first year DNP in the psychiatric mental health program. I'm also the current university senator representing the School of Nursing at Columbia at large. I started off in this nurse tech position in the temperature screening program that was developed alongside the other position. And I started off at the Allen Hospital. I remember seeing Courtney there many times, just running around doing her job, you know. And I also did a few shifts at Lower Manhattan Hospital before going full-time at NYP, Columbia at Milstein. And I can say that that lobby became like a microcosm, a small universe of what was happening on the outside in the community. As soon as we started, you had very little folks coming in to visit. A lot of the unfortunate and horrible deaths that we saw. A lot of folks potentially did not have somebody at their side just because of the precautions that were being taken, which was heartbreaking. But as time went by, being in that position, I was able to see the work that NYP was doing and then the governor was doing and everything that was happening with the local health departments, everything, and the curve as it slowly flattened. But still, I also saw innovation. I saw fast response. I saw things that I probably wouldn't have seen if this pandemic hadn't happened, as unfortunate as it was. I saw so much love from the community. I would walk around Washington Heights and folks would, just be super supportive. So I think that even though this pandemic was heartbreaking and continues to challenge us and kind of make us think in new and innovative ways, in a lot of ways, I think it uncovered a lot of things and has created more preparedness, in the hospital system, in the university system, in the community. It has brought a lot of folks together, whether it has been through shared pain or through just shared hope. I was able through the position learn a lot of things because it was, even though it was just temperature screening, and I don't like to use the word just because I did a lot of other things. I kind of, besides just taking temperature and educating the public on current COVID science and why these temperatures were being taken, the significance of asking questions. I also did a few other things that were kind of out of my, scope. A lot of the times I acted as a patient navigator. I would take patients that were scared and potentially, usually were Spanish speakers, who would just grab me by the arm and they just needed somebody there for them. And I remember one particular case with a Ecuadorian family that was really impacting, and I kind of spoke about in a project that I'm just going to plug in here called Art in the Time of Crisis that Columbia Nursing is doing. And I followed her from when her father was admitted to his untimely death, and just seeing the family go through thick and thin, hardships. And I was there for her every time she came and kind of guided her through the hospital. She was just super scared. And it really allowed me to just be a human being and just give that aspect of nursing that is just so us, heart, humility, compassion, empathy. I saw people from all across the United States come and go, nurses from all over the place. And I think that those months really just impacted us all for the rest of our lives. I think I'll be talking about this to my, grandchildren and my kids and all that. So I'm really grateful for the partnership and the opportunity. I know we're gonna beat the second wave and do good by our community. So thank you. I would like to now present Katherine, who's gonna come after me, and I appreciate all your time.
Hi, thank you, Alden and Danielle and everyone else who spoke. My name is Katherine. I go by Kathy. I recently graduated from the MD program at Columbia. So I'm the newest alumni, I suppose. And I'm actually joining the Columbia Presbyterian team as an RN at the Cancer Center. I'm an acute leukemia group. So that's my next step. But I was placed as a tech at Allen Hospital, where Alden had just mentioned. And Allen Hospital, to kind of give everyone an idea of what it looks like, it's a small community hospital up kind of near the northern Bronx area, near Riverdale in that sense. And it has about 220 beds. So it's a community hospital. It has everything from postpartum, labor and delivery, psychiatric care, all of that. And that hospital was very quickly turned into an entire COVID hospital. Every single unit became a COVID unit on that in Allen. So that's to say my experience was very difficult, and particularly my first night. I always start off with my first night because I think that was the hardest night. It was the biggest hump to get over and decide to keep coming back every day until the end of our contract was, which was in around July. And so I have a couple of points to just touch on lessons that I learned that I think could be entire classes in a nursing school. But I learned all of these things in my shifts, and particularly even just that first night. So I worked the night shifts, 12-hour shifts, 3 days a week. My first night, I saw 3 deaths within before my first break, which was at 1 in the morning, and then 3 post my break. So about 6 deaths in that first night. And this was about the week before Easter. So my first point I wanted to talk about was spirituality and prayer, which I think was very, very important for all the nurses and the healthcare workers there. I was on a unit that is usually a world-renowned spine unit, has the nicest beds, everything is just beautiful, and the unit was a mess. And it was not to anyone's fault. It was literally the capacity of how many patients were there at that time. There were patients, and I've never seen this at any NYP hospital, but patients being funneled from the ER into the hallway because there was nowhere to go for these patients. So COVID was everywhere because every patient had COVID and they were in the hallway, and the air, even at the nursing station, full of COVID. So that night, like I said, was prior to Easter, and I had never prayed with a patient before, but I prayed with almost every patient I came into contact with, even the ones who were not responding to me. A lot of people were just not conscious. They were having very difficult time breathing, and a lot of them were on comfort care, which means that they were on their, they were being comforted into their stage of death. So I prayed a lot with them, and I remember a specific patient who was so eager to see her family on Easter, and I would just talk to her about my Easter or what I usually do on Easter or Good Friday or something like that, to kind of give her a nice image. And we spoke that night, and that was the first time of many times after that a patient told me, "I love you," in Spanish. Everyone basically was speaking Spanish there, but they told me, "I love you." And she reminded me a lot of my grandma. So that was really difficult. But that point is just to say that spirituality and prayer carried a lot of nurses, their faith and their hope alive, and kept them going throughout this time. My second point I wanted to make was on ethical decisions and how nurses can make ethical decisions in a time where everything is very crunched and pressured. I was on a postpartum floor that was now turned into all COVID. And I had a patient who had been confirmed DNR, DNI twice by her daughter and her physicians. And I was on the overnight shift. So, there was no one really there to talk to about that DNR code status. but she was wide awake. She was one of the youngest patients I had seen. She was very conscious of herself losing her breath, and she gripped my hand and told me, I don't, like, keep me alive. And I didn't know what to do at that point. That was the first time I ever faced somebody who was clearly put on DNR, DNI, telling me that they wanted to stay alive, to do everything possible to keep her alive. And she would not let me leave the room. And I was the only tech on that floor, and there was 2 new grad nurses who had only taken care of postpartum patients and 1 med-surg charge nurse. So we were really crunched on time, and I really needed to go back to other patients, but that was such a difficult decision to, you know, leave her and not know who to go to about that ethical decision. So I looked into a lot of ethics, and we learned a lot about it in those, in like our classes where we talked about what was going on. It was kind of our therapy sessions. I remember Danielle was in one of mine, in my circle of care is what we called it. So that's my second point, is ethics. And my third point is generally treating the patient as a whole person and their families. There's so many patients that were, you know, dying alone, and they wanted to be with their families. And I had met 3 patients whose family members were being treated in the same hospital. One of them's wife was even in the same room, who had passed away while he was in the room, and he wasn't even able to say bye to her because they both had very difficult time breathing. So that's to say, nurses are really held on a crutch to be patient advocates, especially during the times of COVID, because they don't have their family members around to advocate for them. You know, nurses were getting calls here and there on the phone to hear updates about family members, and they just couldn't get to the phone in time to talk about it. So that being said, the nurses were super overwhelmed, and I was just so great. I'm so grateful for the opportunity to have helped them out in this time when they were so clearly overwhelmed and really in need of the help. And I'm so happy to join the NYP family coming this January. Thanks. Yeah.
I want to thank all of our students, Kathy, Alden, Danielle, and our amazing speakers, Courtney and Heidi, for sharing your really personal stories, the narrative that you shared about your experience and the knowledge that you've gained. I'm a little emotional because it's been a tough year for each and every one of us. And some of the themes that we've shared during this session revolve around connections, holistic nursing, relational leadership, again, at the front line, all the way up to the COOs and CNOs, VPs, literally every nurse leading through this pandemic. So first, we want to start with questions that were submitted by our audience for our speakers beforehand. And if you have any questions, please submit them in the chat feature and we will get to them time permitting. So I have my first question, and please jump in if anyone can answer. What lessons have you learned from this year that you will bring into 2021? Would any of our speakers like to share?
I can start. I think for me, starting really with the formation of our academic practice fellowship, I think what we recognize increasingly so is that we can be better together. And so for me, what I'll carry into 2021 is how can we continue to innovate together in order to advance nursing practice. And so for me, I'm committed to that. I absolutely love this partnership, and I think we can figure out other things to do together that are mutually beneficial.
Thank you, Courtney. Would anyone else like to share something you've learned or just experience in 2020 that you're going to bring into the new year?
I can go. For me, it's the power of adaptability, and that independent of the situation and like the circumstance, that there are always very profound lessons to learn by being adaptable. So I think that 2020 has definitely made me more adaptable, and that'll mark my career going forward.
Thank you for sharing. Personally, I've learned many lessons about myself, my teams, and my community. Again, resiliency. But one of the things I'm going to very intentionally practice is with the experience and feeling of grief. There are so many things we've lost, tangible and untangible. I want to experience and put out into the universe much more gratitude. I'm always grateful, but I need to be more intentional about just being thankful for the things that I do have, the people around me, and that's just something that stands out. I think, as you've all shared, those connections will keep us strong, and we can handle just about anything, especially as the School of Nursing and NYP. Together, we're better. Absolutely, Courtney. That's going to be the new slogan. I have one more question. Oh, yes, Susan, please.
I wanted to add in there, and I think Kathy had spoken about it so eloquently, is the need to acknowledge and identify spirituality. What was unique to this program really, and I think I really attribute the success to that circle of caring. Am I getting it right? I can't imagine the students going through this experience without having had that support. And I think that was really crucial. And it really highlights the need for, as professionals, that we meet, not only our physical needs and rest, and, there's a lot of talk about self-care, but that spiritual component to keep us whole.
Can I also say something, Rose? I've definitely from 2020 have been like sharing with family and friends that like life is short, like, not only just like physically, we have witnessed that this year, but also just in a more like abstract way, like, just kind of living life and in the moment and being grateful. Like you spoke to gratitude of where we are now, what our roles are, regardless of if we're working or if we're with our family, and just acknowledging, like when I spoke about my experience, like being grateful that I was there to be of service to these nurses, and, living in that moment and saying, okay, maybe I'm here to just be of a listening ear and a support to these nurses who have been going through trauma since March. And now that I'm here, maybe I'm going to offer them just, some time when it's right, a positive, a joke here or two, or some, when the time, just to give them some relief and outside of the chaos that they had been experiencing for months.
Thank you for sharing, Danielle. Anyone else? I'll jump into the next question. Virtual technology. We're zooming in and out. We're making sure we're unmuted. How do you sustain connections in this new age and era as we're appears heading into a second wave? What are some of the ways that you are really sustaining your either spiritual or emotional connections?
I can start again because I did a lot of rounding today. So as Alden said, I believe that leadership visibility is imperative, especially during times like this. I had a mentor once who told me that the truth never reaches your office, and I live by that wholeheartedly. I like to go out and talk to the frontline staff to understand what their challenges are and what they need. And obviously resiliency is our biggest concern right now, so it becomes even more important. So for me, fortunately, we know how to safely interact with each other in the clinical spaces. And so that for me has become important for my own resiliency and mental health. So having that face-to-face conversation and being near people sustains me, and more so now than it did before. So I will continue to round.
I think I would have to agree with the rounding, even though we've connected daily, sometimes several times a day with our students on Zoom. Nothing compares to the ability to be able to round. Candace Smith and I have adopted this practice pretty heavily. Every Wednesday, Thursday, our students are in their clinical rotations, and we feel it's really important they see the leaders of their program so that they can connect with us and talk about what they feel is important and what they need to be successful as they're caring for patients during this pandemic, and also continuing their education and their well-being. And there's something that you just can't account for in an email or a Zoom session, that when you go to see people at the site, it surpasses everything. In addition to connecting with the students, we're able to connect with the nurses that are mentoring our students and the nursing leadership. We always make sure we stop in and see the PCD on the floor and have a conversation with all the nurses that are working with our students. And I think that's really helped the connection with NYP, and it's built it to this level of true partnership. And it's so nice to be able to see, like, the one quote you said, Courtney, where she said the nurse had mentioned how she taught the student during their clinical rotations, and now they were here in this role as the nursing aide and nursing tech. And some of the nurses that work at NYP are now clinical instructors for us if their time schedule is available. So it's that connection on the unit in the hospital, even if we're all masked up.
Thank you, Heidi. It appears someone put into the chat, Jennifer Dorn, I want a gratitude. I want to acknowledge that this partnership is one being shared globally with our nursing colleagues. Courtney has graciously spoken at PAHO WHO on International Nurses Day in May about the frontline work of nurses at NYP and Columbia School of Nursing, and also to over 400 nurses during a webinar to exchange best practices with nurses in Wuhan, China. We are part of a robust, courageous, and knowledgeable nursing circle in all countries. Absolutely well said. It is International Nursing Year of the Nurse. Would anyone want to ask a question of our panelists to another panelist? We've got a good couple of, like, 5 minutes left.
I'll ask a question to the students. As we ramp up and roll into phase 2, what is it that you would change? What could we have done differently as we bring you back on, so you and or your colleagues? Were we perfect?
Say that I think it was for the time crunch that we were in back in April. I don't think it could have really gone smoother for what the time was. And I think a lot of the issues self-corrected themselves because the students were able to speak out about their issue, whatever issues came up. They went to their faculty liaison or someone in at Columbia to talk about that issue. So I definitely think that it's very important to continue having a liaison that the students can feel comfortable going to in case they see something that they're uncomfortable with, but feel kind of a little squirrely about to go to, like, somebody on administration at NYP, because, you know, everyone wants to keep a good reputation. So especially students who are very vulnerable to being kind of unacknowledged, allowing them to have somebody that they can really confide in on the side of Columbia to make sure that there's a lot of good communication going on there.
Kathy, that's a really good point, because we did have instances where students would come to their faculty liaison and we would go to Susan or Courtney to work on a solution. And I think it was really beneficial to have that line of communication all the way through, from the school, from the student to the nurse leaders over at NYP through the faculty. Thank you.
We'll definitely bring that back. Alden?
Yeah, so I also wanted to echo what Katherine was saying. I think given the circumstance, the mobilization was quick, and a lot of things did self-correct with time. So I applaud that. The only, I guess, suggestion that I would have is that, you know, we are seeing short-term, midterm, and we will be seeing long-term effects of just the situation and all of the different, the racial uprising after the murders of George Floyd, Breonna Taylor, and a lot of other things that have been happening, global natural disasters. Here in Honduras, we just had like crazy hurricanes. So I think that following students who participate in these events kind of long-term and providing resources is something that is extremely important, and kind of giving them a little bit more attention in terms of what they might need. And I feel like that's the only thing that I would add, just because as time goes and with the new wave and the hardship that's going to bring undoubtedly, they will need support.
Thank you for that.
Good point, Aiden.
We're trying to understand that in our own workforce. And so I think collaborating with the school to figure out how we can support you differently, knowing that times have changed, will be an imperative. So I appreciate that feedback very much.
I would just speak to what Kathy and Alden said regarding the communication was really well done with having the middleman being Columbia, and NYP. It was really helpful having someone to speak to, and I had the opportunity to talk with the nurse managers myself if I felt like I wanted to address something. And I did also want to shout out NYP and the nurse managers that I worked with the PPE, the way NYP handled the PPE concerns. When I accepted this collaboration, that was definitely a fear of mine and my family's of going on, because on the news it was just like this huge fear mongering of like no PPE is available, no masks are available. So I was a little afraid of what to expect, but I will say that the nurses and the nurse managers did a great job of managing the PPE intake, making sure that we were taken care of, and making sure that we were monitoring the usage and not wasting, and just really, making sure that we were protected and safe. So I want to say thank you for that, because it really took a lot of anxiety down that was already going to be there throughout the time that we were in this collaboration.
I'm so glad you felt safe. Thank you again, all of you, for coming. You really, we couldn't have done it without you. You saved us.
Well, I want to thank everyone for joining us tonight. This was a wonderful program, and I hope you enjoyed it as much as I did. If anyone has any further questions, please reach out to the Office of Development and Alumni Relations. And I'm going to make a shameless plug to stay connected and mask on. Have a lovely night. Thank you, everyone.
Thank you for having me.